Hello, good morning, good afternoon, good evening, wherever you are in the world. A very warm welcome to Meet Menaka, the episode 80. Today, we are going to talk about promoting oral health, the part 2, with Dr. Ajay Devra, Dr. Frank Leslie Robert, Dr. Lankar Mahesh, and Dr. Pamela Susay. Before I go into their details, the esteemed speakers today, I will talk about the talk show briefly. What is Meet Menaka? It features experts in various fields and real people sharing real stories. It's a vibrant 90 minutes multicultural online talk show to celebrate you. All our episodes are then posted on YouTube. It's called Meet Menaka. You can find the library of videos of past 79 episodes so far. Please support our amazing channel to add value, to share inspirational messages, and create positive change by subscribing and become the change makers you are. Now back to the speakers. It is a special episode once again because we all studied together dentistry 3 decades back. And I cannot wait to start this show because I'm sure it's going to be a lot of fun. Firstly, let me introduce Dr. Ajay Devra. He did his bachelor's from Bangalore University and master's in oral and maxillofacial surgery from Savita Dental College, Chennai in 2001. Currently, he is professor and head in the Department of Oral and Maxillofacial Surgery in Genesis Institute of Dental Science and Research, Ferozepur, Punjab. He is the author of many scientific papers and has presented extensively in national and international meetings on facial trauma, orthodontic surgeries, and dental implants. He is a fellow and diplomat of ICOI USA. He is also a former president of AOMSI Punjab chapter. Now, the second speaker, Dr. Frank Leslie Robert. He has had his master's in implantology UCAM, ICNOG, that is diplomat in neuromuscular orthodontics and natology, short-term courses in laser dentistry, worked in Ministry of Health as HOD, that is Head of Department, Bala Hospital from 2001 to 2019, and presently working in Amazon Dental Center, Nizwa, Oman, 2020 till date. He served with Indian School Nizwa for dental and charitable organization for school health programs in Omani and Indian schools. And he has also conducted Bala Dental Symposium for Oman. Now, the next speaker, it's a privilege to introduce Dr. Lankar Mahesh. He has done his bachelor's in dental surgery, master's in business administration, and diploma in hospital administration, and a diploma in health and hospital management. Apart from that, Dr. Lankar has also completed his master's certificate in implant dentistry from UCLA, USA, and CUF in Thailand. He is a visiting professor at the University of Murcia at Spain. He is also the academic director of postgraduate education at UCAM Spain. He is an honorary visiting professor at ITS College of Dentistry, Ghaziabad, UP, India. He is currently pursuing his PhD in integrated implantology. He is an honorary consultant to the Armed Forces of India. Dr. Lankar Mahesh is a fellow and diplomat of ICOI USA and also fellow and member of credentialing committee, World Academy of Ultrasonic Surgery, Korea. He is the editor-in-chief, the International Journal of the Oral Implantology and Clinical Research. He has lectured globally and has over 188 publications in the national and international peer-reviewed journals. Dr. Lankar Mahesh is the author of the textbook Practical Guide to Implant Dentistry, published by Quintessence. He has authored the textbook Color Atlas of Oral Implantology, along with Craig Mish, David Spratt, and Praful Bali, which was released by the President of India, Sri Pranab Mukherjee, on 17 May 2017 at the Rashtrapati Bhavan. Currently, Dr. Lankar is in private specialized implant practice at New Delhi, India. He has trained over 6,000 dentists in the field of oral implantology. Now we come to the last but not the least, speaker Pamela Susay. She's a general dentist in Santa Maria, Central Coast, California, worked 10 plus years in the field of general, family, and cosmetic dentistry, performed CEREC and dental implants, member of American Dental Association, California Dental Association, and Central Coast Dental Association. Performed voluntary services placing dental implants in the Dominican Republic. She also volunteered at local Give Kids a Smile events, providing free oral care to underserved kids. And this is something I love. She believes that oral health is overall health. So a very warm welcome to all the four speakers. And as I mentioned, we all studied together almost 3 decades back, and it's a privilege and honor to have you all. A very warm welcome.
Thank you.
Thank you.
Thank you.
Firstly, today is International Dentist Day. So happy International Dentist Day for everyone. And that's the reason we decided to have this show today. We are going to be speaking about slightly advanced dentistry today than the one we spoke in the previous episode. But prior to that, let me start with Lankar. Lankar, why do you think promoting oral health is important?
You don't have teeth, you can't smile, you can't eat. That's what they say. When you smile till you have teeth. Later you can only laugh.
Thank you, Lankar. Ajay, what's your take on it?
Yeah, as you mentioned, teeth are the reflection of our body, and healthy teeth definitely gives you a lot of confidence. And obviously, when you have to eat, so you need a teeth. And for having a good teeth, oral hygiene is very, very important.
Sure. Thank you. Frank, what's your take on it?
You have the inner beauty and the outer beauty. Inner beauty is from the heart and the outer beauty is from the face. The smile is the beauty of the face. Yeah.
Oh my poet.
You have the functional beauty. So teeth gives the function so that you can eat and be strong and healthy.
Sure. Thank you, Frank. Pam, what is your take on it?
Hi, Menaka. Thank you for having me over. To me, smiling is one of the most important part of life. It not only builds a relationship, but it also has a lasting impression, a lasting first impression. So I think with that smile, when you have good oral health, that's what you have, a good smile. And life is short, so as long as you have teeth, smile.
So that's the reason my training company is called Smile Leadership Academy. My practice is called Smile. So it's all to do with smile. I think yes. For me, what I say about smile is it is a gift you can give yourself and others simultaneously.
Very true.
Yeah.
Pam, let me start with you. Because cosmetic dentistry is something which is picking up. Everybody wants some form of cosmetic dentistry these days. So why do you need cosmetic dentistry? What is your take on it? I know it is a special interest for you, so hence I'm asking you this question.
Yeah, cosmetic dentistry, like I said, like smiling is one of the most important parts of our lives. It not only builds up lasting first impressions, also creates emotional beings. So that being said, a lot of people want like a nice smile that boosts their confidence, they boost their morale. So they come to the dentist for various reasons. It could have been a small chip or broken teeth that we can easily fix with just like bonding with resins. Or if there's a space in between the teeth, either do resins if it's a small minor gaps in between the teeth, or if it's like a major thing, something like orthodontics would help them. We also have crowns and bridges, dental veneers that we can, use. Dental veneers are basically like porcelain facings that you can place on the teeth that are discolored, stained, various reasons. And then we have tooth whitening systems, either in-house tooth whitening systems or take-home counters, on the counter that you can take home, like toothpaste, whitening mouthwashes, or even just bleaching trays that they can do it at home. So due to various reasons like discolored teeth, stained teeth or discolored teeth due to food, smoking, just childhood developmental defects of the enamel, all these can help with the cosmetic dentistry. So when the patient comes in, they want a Hollywood, some patients just want a Hollywood smile, just one whiter, brighter smile, right? They just want a nice set of teeth. So that we would recommend in-house bleaching or like take-home trays that we would recommend.
Sure.
And that's what cosmetic dentistry is all about.
Okay. Thank you so much, Pam. It was a really good explanation. When you were talking about veneers and crowns, I was thinking people often get really mixed up with these two. The way I normally explain is the crown is almost like a hat, and veneers, you ladies will definitely know, like the artificial nails you put on, or the acrylic artificial nails. So, that's the way it is pretty different. But I think if I was a dentist, perhaps I would be confused too. So I think that's something what I was thinking about. And yes, like you said, everybody dreams of a Hollywood smile these days. And even in the UK, we used to have 10 years younger, and in that program, the virtual reality show, and actually the dentist used to do a lot of work to make sure that they really looked 10 years younger almost. Partly illusion, partly reality.
Each one has an individual need, and depending on the conditions and their overall oral hygiene, we recommend certain, to suit everybody's needs, so that patient is satisfied. Patient is satisfied generally, aesthetically pleasing results. So that's what we're looking for.
Sure.
You have beautiful teeth, so your patients will always want to copy your teeth.
We all have habits.
We have to practice what we preach, right?
Otherwise, obviously, patients will
tell
us to look after our own teeth first. Okay, so the next question to you, Pat.
They want the whiter, brighter, like perfect.
I have a lot of European and American patients, and like you call it a Hollywood smile. Yeah. You can call it a Bollywood smile also. Because, white teeth don't mean good teeth.
Yes, correct.
They want A1 plus shade coming from California, and the lab replicates it, but why?
It's just a general. This is just a generalized term, Hollywood smile.
I go to the US, but why? I'm just generally asking. Yeah. As a layman, not as a doctor.
Lanka, as a layman, if you're asking as a layman, it's a very subjective thing. It's like everything else in life. People can have their own choice. And if they want to have a Hollywood smile, why not?
Yeah, I agree. But why is it that it's super white? We don't have take-home whitening kits in India.
Okay.
We don't have over-the-counter take-home whitening kits. In-house whitening is very less. It is done by Zoom or Philips on the chair, or it's by one of those bleaching trays or one of those things. What is your take for a layman? Because I have never advised anyone to do bleaching at home.
Yeah.
There used to be a pen called Magic Pen that came from Germany. And I tried that myself, and to be honest, it was not very good. I think it should be done by a professional dentist always.
Lanka, briefly, I'm just going to explain. I know in India, I wasn't sure about I know in India, there's not much of the take-home trays, but I would recommend just generally, like just basic oral hygiene, flossing, brushing regularly, like brushing twice a day, flossing every day. And then just basically using a like a tooth whitening toothpaste, tooth whitening mouthwashes, just basically doing those things at home would help. And if you have the opportunity, and you could always get, everybody wants to have nice white bright teeth, but I'm not saying nice white bright teeth, but healthy bright teeth, right?
Yes.
Like we always said, the smile, like healthy teeth, white teeth is like a reflection, right? Like I said before, it boosts a little bit of confidence. You can go out there and do interviews, go out there, meet people. It's like a lasting first impression. So if you have the opportunity, go ahead and do the in-house whitening, which is much more safer. It's in a controlled environment, and then you're doing it in a dental office setting. So even if you have post-op sensitivity, you're taken care of. You're given a tray to have the post-op. You're given like a desensitizing toothpaste to help with the post-op sensitivity, and it's done in a controlled environment. So in that way, because it's very popular here in the US, a lot of people do it. I do have patients coming with post-op sensitivity, but then they're taken care of. So yes, there are different ways of doing it. And like I said, it's just not tooth whitening. You can get other things like veneers, crowns and bridges. Even implants can be done. Even if you have crooked teeth, you can still do orthodontics. There are so many other ways, but like the easiest and the simplest, most affordable, I would think, just do the tooth whitening like that.
Yeah. I agree with Pam in the sense, because the looks are always subjective. If they want it, who are we to tell what not to have or to have? I think that's my take on it. Next question to you, Pam. You have mentioned cosmetic dentistry. So what are the procedures are included in? You mentioned already a few because the topic of whitening came. But what would you be? So you will say, Vinny, so in which order would you tell for people to think about those options?
I would say starting from the easiest and the least expensive would be dental bonding or resin restorations.
That filling for people who don't.
Yes, it's like a filling is basically have small cavities, small chips in their tooth, broken teeth, something that is easily restorable that can be done in the dental office. And those are like cosmetic dentistry. It's basically prepping the tooth, removing out the cavity, removing out the broken pieces, and just bonding the tooth with resin. Same tooth color. Before it was silver amalgam fillings that we used to do, which was not cosmetically pleasing, but a lot of patients want the tooth colored fillings, and that's what it is. And then the next one would be porcelain crowns, porcelain veneers. Like you already said, porcelain veneers are things very thin, very minimal tooth preparation, and mostly used to cover up stains on teeth, like discolored teeth due to tetracycline stainings, things like that. Very minimal preparation, so not much of the tooth is involved. And a little major work would be crowns and bridges. Again, they're all made out of ceramic materials, tooth color restorations. The shade can be selected by the patient, with patient and dentist together. The third one would, and those are also kind of a little bit affordable. Then we have, again, like I said, tooth whitening, which is the most popular procedure right now. I mean, again, no tooth preparation, but yes, we do. It's mostly on the surface of the tooth. Like I said, there are take-home kits, plus there are in-office whitening systems. And if it comes to a little bit major work, like teeth that are crooked, like the bite is off, then we recommend like orthodontics or braces that we call. Could be, the long-term, short-term braces, the Invisalign and the braces. I know we're going to go deeper into that. And of course, the last one would be if there are a lot of teeth involved, multiple teeth involved, a lot of work that needs to be done, then we do like a full mouth reconstruction. So basically, this is just like a summary of the different kinds of procedures that we recommend in the dental office. And the basic thing is the patient has to come in, get like a comprehensive exam or like a full mouth exam, and then once the treatment plan is given out to them, choose what is best for them, because each person has their own individual needs, what fits their lives, the schedule, their work schedule, their life schedule, what they really want, what is their end desire, what is the outcome that they want in the end. That's the most important thing, I believe in.
Sure. Thanks, Pam. Thank you so much. And coming back to Lankar's point on whitening, I think I was thinking while he was speaking, it's mainly because I think in-house whitening is always best if they need it, because a dentist would be able to see, because you might be having cavities, you might need restorations, you might have other contraindications. That's the only way you're going to be able to know, is that the right treatment for you or not. So I think more than the procedure itself, having a comprehensive examination and finding out, is it fit for purpose? I think that's why I think in-house whitening is so much better if it is needed. What do you think, Pat?
You're absolutely right, Menaka. Like I said, you have to come in for a full mouth exam, where the dentist does the full mouth exam, takes x-rays, takes different kinds of photographs, before and after photographs. Some patients bring before pictures and say, this is how my teeth look like. Can you make it look like that? And it also depends on, what stages of their life they are in, how, what kind of condition their oral hygiene is. So get them, just do a comprehensive exam, get them to have a good teeth cleaning, just good oral prophylaxis, get all the work done. And of course, the end result will always be aesthetically pleasing, and it also fulfills the patient's desires too. We have to satisfy there.
And also it is less invasive, I think.
In less invasive.
And the other thing I was thinking about is microabrasion before we go into veneers and crowns. Of course, it might not be as sparkly as veneers and crown, but it is definitely worth a go because it's much less invasive. What do you think, Fran?
Yes, definitely. In those cases too, right now we're seeing a lot of patients with microabrasions, erosion, attrition, just wearing of teeth. It could be pathological, mechanical, different procedures. So depending on that, it depends. If they are like very small cases, then we just do like composite resin restorations, try to maintain their sensitivity. A lot of patients complain of sensitivity. We start off with a very conservative method of doing desensitizing, advising them desensitizing toothpaste, and then work from there, and then try to, like the brushing habits, everything. There's a whole bunch of things, the brushing habits, what kind of toothpaste, are they using abrasive toothpaste, non-abrasive toothpaste, and are they using any other kinds of abrasive materials? Like, nowadays it's like very common to have charcoal toothpaste and lime and baking soda and those kind of things. So basically just get to know what they're using, what kind of oral hygiene they have, and go from there.
And these days, electric toothbrushes, so many electric toothbrushes come. When you brush with too much force, it stops. So there are different things you can.
They have toothbrushes that have the indicator. There's a red light, a blue light, and a green light. Very helpful, very educative to patients. It shows you how much pressure you're putting on your tooth. Are you covering all the 32 teeth or whatever, how many ever teeth there are in the mouth? So it kind of educates the patient, kind of makes them more interactive, and kind of makes them more, the toothbrushing doesn't just become a chore, it just becomes a part of their daily routine.
Thank you, Pam. So we talked about the, what are the procedures are there. So what common dental problems are suitable for cosmetic dentistry in general? What do people come to you and say, we need cosmetic treatment for?
Like basically is the first one would be like broken teeth, like a small cavity that they want, or it's to fix. And then, like I said, resin restorations. Then we have, or we can do veneers, crowns and bridges, just discolored teeth, stained teeth. And staining usually occurs due to either in early childhood or due to certain antibiotics, like, like tetracycline staining, the injury to teeth due to trauma, or damage to the teeth during development, like dark stains due to food, like excessive or smoking, like wine, red wine, all those, anything that stains a white cloth will stain a tooth. So basically, those are the other the dental problems. Then there are spaces between teeth, or we call gaps between teeth. Again, like I said, braces, orthodontics, bonding, resin restorations, crowns and bridges can be done. Also, when the teeth are like what we call like peg lateral teeth, the size of the teeth are small or uneven, just to make it look a little bit natural appearance. That's one of the teeth. Uneven teeth, worn down teeth,
and the shape of the tooth.
Like you said, worn down teeth, and even excessive gum tissue. Sometimes, you can do like some kind of procedure, laser procedure, to just maintain that. So these are basically general problems that, patients come in. And then of course they just want just a white teeth, even teeth, just a good smile. And that's what.
Thanks, Pam. Yeah, because I heard you mention about spacing, but crowding is also on the other opposite spectrum. Yes. Some people are not happy because they have spacing, and then some other people are not happy because they have crowding. So it's like anything else in life, it's two different spectrums, I guess. So as a layman, if I am coming to you as a cosmetic dentist, what question should one ask you about cosmetic dentistry?
So basically, when you come in, you have to know what your end goal and desires for the procedures are. What are you looking? What do you want? What are the results you're looking in? In the end, and are you being satisfied? So what I would go, if I were a layperson, go to a dentist and ask is, how can I improve my smile? What can I make? Here are my problems. This is my, just be honest just be honest to the dentist. Say, this is what I have. What can I do to improve my smile? What can I do to make my oral hygiene better? How often should I have a dental exam and cleaning? And once the procedures have been done, what can I do to maintain those procedures? What can I do to maintain my oral hygiene, right? Once the procedures are done. And then, and what are the benefits and risks or advantages and disadvantages of each when they present the treatment plan? What are the benefits? What are the risks? What's the advantage? What are the disadvantages? And these are the basic questions that I ask. And then, of course, research the dentist, check, see, have them show a before and after photographs if they have any of those, and then research, and then just have the faith and confidence, I would guess, and then just have a relaxing, just have regular dental checkups and cleanings. That'll help you kind of relax and have a enjoyable experience. So
sure. Yeah, thanks, Pam. I think it's about firstly having a clarity in your mind what you want, isn't it? Because sometimes people are not really sure what they want or we want as human beings when we go. And it's like any other service sector, healthcare, and in particular dentistry is no different. It's all about communication, communication, and more communication, right? So, like you said, it sets expectations from the patient's point of view. And when, as a layperson, when you go to the dentist, please set your expectations. And I think it is the responsibility of the healthcare professional or the dentist then to tell them what kind of expectations they can actually meet. And some are not, they won't be able to meet. And I think it's very important to be candid and say, this is what we can do, and this is what we might not be able to do, and this is something we cannot do. I think if those things are clear, it's really, I think the experience between the dentist and the patient becomes, or service user becomes so much more easy and more pleasant.
Relaxed. Yes,
relaxed. That's what I think.
They have to have a realistic, they have to have something realistic expectations. It can't be like way out there. So just be a little bit more realistic and just follow the protocol, follow the treatment plan, come for your 6 months visit, get your regular cleaning, do your own in-house, just basic, like I said, brushing, flossing, if you do just the basic, I think you should be good.
Sure. And also don't be put off, I would say, as a patient, if you go to the dentist, and if they say, it is going to take a year before we can start this treatment, because you might have more important things in your oral cavity to be dealt with before they can go and do whitening or veneers or crowns and extending restorative work. So I think the rule of thumb in dentistry is start simple, isn't it?
Yes, start simple, yes. Yeah,
and go into more complex. And so, of course, this is aimed at for lay people mainly to understand. So we won't go into treatment planning comprehensively, but it's really important not to be disheartened and to expect that you might not start the treatment what you want, particularly the cosmetic treatment, from the word go. You might need other treatments or other stabilization procedures before you get to that point, isn't it?
End result. Yes, you're absolutely right.
Thank you so much, Pam. I'm sure we'll come back to you with more questions later.
Thank you. Thank you.
So now it is Dr. Frank Risley. Robert, Frank, what is orthodontic treatment? I know you are into orthodontics.
Yeah, to be short, orthodontic is something like your clip treatment in layman's term. You have brackets all around the teeth. This is the model. I just brought a model. I don't know if you can see it. So
kind of. It's disappearing and appearing, but we kind of can see. Yeah.
Okay. So you place brackets around the teeth. That's fixed orthodontics. And you have removable orthodontics, many types of orthodontics. The main goal of orthodontics is proper function of the teeth to give a balanced occlusion, so that when you bite, it occludes like that, so that you chew properly, the food digests properly, and you're being healthy. And
for people who are listening to, occlusion is nothing but a fancy word for biting.
So if the bite is proper, you chew properly, and you produce less caries. Saliva flow is good, And also you have a joint here, the temporomandibular joint, that is taken care of well when it is balanced occlusion, when the bite is balanced, both the left and the right side. So that's the main functional goal of orthodontics. The second one is, of course, what we explained is the healthy smile brings a value to your face, or your face value is increased and self-esteem is increased, other than cosmetics, which Pamela explained wonderfully. Orthodontics, the other way of closing the gaps, what you can say in layman's terms, yeah, basically.
Closing the gaps, reducing the crowding.
Reducing the crowded teeth and putting it in its place to make a beautiful smile, give you a beautiful smile, yeah.
Sure. Thank you. And I think when it comes to orthodontics, I think I would really remind all the patients, at least in the UK, I know that till 18, it's free dental treatment. So the earlier you take your kids to a dentist, the earlier these things, defects, any issues will be picked up. They can be referred to a specialist if they need be. They can plan their treatment very well. And I can't find, at least personally, one single reason why you wouldn't take your kids to dentist. So as soon as you see teeth in the mouth, it's time to go to a dentist. It's as simple as that. So, because you don't know, you could have various issues. I know it's not everything is to do with orthodontics, but it's really, really important, isn't it, Frank? Okay, so and also orthodontics is it's more to do with functionality and looks, but it is also about psychological well-being sometimes, because kids can get bullied at school. As for parents, you might think that smile is okay, but if the kid is saying that smile is not okay, which means that's not okay. As I said before, it is very subjective. So if the person who bears the teeth wants something to be done, I think you have to take it seriously. That's my humble opinion on that. Thank you. Next question to you, Frank. So what are the benefits of orthodontic treatment? I know you are into orthodontics, so let me ask that.
Yeah, the benefits is that what I told you, to have a proper function, proper bite, so that they can chew properly and then have a better smile. So in this is the basic thing. And then there are researches which are going on, like what you said, psychological issues, like you have left and right balanced, like balanced occlusion. They say if it is a cross bite or if the jaw is moving towards the right hand side, even the shoulder and the legs, maybe the leg may be shorter one side and the leg may be longer on other side, and shoulder may be slanting to one side. These are the things, researches which are going on, where I studied in this neuromuscular gnathology and all that. So the spine, the shoulder, and the leg all slant to one side. If your jaw is moving to your right, everything slopes towards the right, and people walk like that, one side. So that also leads to many things in psychology. I don't know how they're related to it, but they say the person who doesn't walk straight, who slopes to one side or slants to one side, they have some kind of psychological issues, or I don't know.
There are enough psychiatrists on this forum, so I'm not going to comment anything on that. But coming back to orthodontics itself, Frank mentioned something called temporomandibular joint. It is this joint just before the yellow ear. Yes. Because if you have problems there, you can hear it clicking, you can have pain when you chew, and you can also have headaches, different problems. So that's the reason Frank was obviously mentioning that. But if you didn't understand what is for lay people, it's temporomandibular joint, and that's where it is. Frank, so you spoke about why orthodontics should be done. What age can we start orthodontic treatment in that case?
Basically, there are two types. Most of them think they should go out to a dentist for an orthodontic treatment after 13 years of age, because most of the 13 to 16 years of age, where most of the permanent teeth are erupted. The canines, upper canines come at 13 years of age, and the second molar come about 14 years of age. So many people think after all the permanent tooth eruption, you should go to an orthodontist. I differ with that, because some of us, we treat early orthodontics, like preventive orthodontics or interceptive orthodontics during the mixed dentition period. Now, the mixed dentition period, what we call is when the milk teeth is falling off and the permanent teeth is coming. So it starts from age 6, where the first permanent tooth comes out. And then it goes on till around 13 years of age, where we have something called as ugly duckling stage, where the canines and the laterals, they come like that. Yeah, you've seen many kids like that with the teeth like this. They just settle down on its own. So no need to go to an orthodontist or a doctor to settle this treatment. So you'll have to just wait till 13 years of age. But there are many treatments like the prognathic jaw, or the lower jaw is growing more, protruding jaw. Maxilla is also growing more, and the mandible is small, like you have bird face or long mandible. So they do something called as the chin cap and the head caps to restrain that, and you can do some muscular retaining. They can put some lip bumpers inside so that the muscle doesn't act on the teeth, so that the teeth doesn't come out. So one of the ways of preventing the teeth coming out or going in is by preventing the muscles of the tongue, which is from inside, and the muscles of your lips. So these are some of the variations in orthodontics other than the clips what you use. So people have to understand this, and then you can talk to the dentist or the orthodontist so that he can do a proper treatment. So even clips with doing this lip bumpers and other kind of prosthesis, which orthodontic appliances they call it as, to prevent muscle pressure on the teeth.
And also for some people, unfortunately, you do have needs surgery, but the surgery can be planned well, and the other options can be very well explored if the patient is brought to you very early, a child is brought to you very early. Am I right, Frank?
Yeah, you have a mixed kind of treatment where you have orthodontic treatment with orthognathic surgery, where you have surgical intervention, because orthodontics, or only the movement of the teeth, doesn't help. So you have to move the jaw also backward. So sure. That is why it is orthodontics. So it's bone.
Thanks, Frank. We are in the instant world, from Instagram to instant photographs to everything instant. So people want quick fix. How long does the orthodontic treatment actually take?
We have many kinds of treatment in ortho. You have the fixed treatment, like the braces, what you put for each teeth. You have the removable, where you have just the appliance like this. I don't know if you can see it. It's blurred.
We cannot.
So it's a plastic thing, and when you remove it and you place it. And now the latest one is, you call it as Invisalign or Clear Correct. You just have like a tray around, and you have set of 10 trays or 20 trays. So it's usually 6 months to 2 years. So 12 months to 36 months, 1 to 2 years. So the basic concept is people should understand that it's not only closing the gaps. After closing the gaps, the tooth comes. You have to maintain the teeth in proper position for 6 months. So the bone should be formed totally, and the teeth, so that the tooth doesn't move back or relapse. So which many people actually don't think about it. Many patients don't think about it. When the gap is closed, they just remove the appliance and throw it off, where you have to fix it with a lingual band or a wire inside, or you have to retain that same position for at least 6 months. Many people, they don't go back to the dentist because they paid enough and they don't want to pay more. Yeah, they don't want to shell out from their pocket, so they just refrain, and then that's a relapse. So they come back, the teeth comes back to the normal position with the gaps like that. So they'll have to go back for the treatment again and waste a lot of money. So this is what I wish every person should understand.
But in my personal opinion, Frank, I think it is so much more complex than that. Because usually who have orthodontic treatment, obviously now more and more often adults are having orthodontic treatment, but usually the majority of them are kids, because kids cannot wait for various reasons, because by the time their treatment is over, normally they're in teenage or early adulthood, and they cannot wait to get the braces out. And I think that is one main reason they don't wear the retainers properly, unless it's a fixed retainer. So I think it's not only just the cost, I think it's also different various other factors playing. Yeah.
Many factors.
Yeah. Thank you. So one last question to you. I think you already mentioned a few, but what are the different types of orthodontics? I know you told about removable fix, and so do you want to summarize something very quickly, please?
We have metal braces for like fixed, I told you, metal braces. You have the ceramic braces where people don't like to show metal. And then people who don't want the orthodontic treatment to be seen, people have, orthodontists have lingual braces where the place is inside, it's not seen at all outside. There are metal or ceramic which are placed on the lingual side, inside towards the tongue. So that's quite difficult for a dentist to do because of the angulation and placement, but that's one. But the latest one now, what they do is, other than the removable, you have the another removable type called as the clear aligner, where they take the upper and lower impression. You have a tray, upper and lower tray, and it's done in a computerized CAD cam where they know how exactly the tooth movement is going to be every 2 weeks or every 15 days. So you have a set of 20 trays for 1 year or 2 years. So every 15 days you visit the dentist, or you keep changing it in your house. No need to go to the dentist, but you have to be regular. So you get that pack of 20 trays. Some of them, they just pack it and send it home. In-house, they do it. They don't even come to the dentist. So that's another thing, that if you don't do it properly, then again, there is a relapse. You'll have to go from the beginning till the end. But then it's an advantage that you can do it in your house also. So that's the latest which is going on: clear correct, or clear aligners, or Invisalign.
Thank you so much, Frank. I think people would have understood what is orthodontics and the options of orthodontics much better. So as I go through the questions, you will understand why it is in this particular order. It is getting more and more complex treatment modalities as we go through. And now it is to Dr. Ajay Devra. So we are going to be talking more of implants initially with Ajay, and then follow on with Lankar. So Ajay, what are dental implants?
Okay, hello everyone. Thank you, Menaka, for giving me this opportunity.
It's a pleasure.
Dental implants. That's the first question. Anybody, any one of our patients, they come and the center, they ask for a dental implant. They think it's a tooth which they are getting, but no, dental implant is not a tooth. It's a prosthesis which is basically we use to replace the missing tooth. It's actually a titanium, made up of a titanium, which we insert. Implant is nothing but it's a prosthesis which is we use for the missing tooth. And yes, we have to wait, and definitely it work as good as your normal teeth. I suppose it's sometimes it's better than your normal teeth, because implant doesn't get decayed or doesn't get any much of a problem as compared to your normal teeth.
Thanks, Ajay. There might have been an interruption. Apologies, because I am trying to host this from Sri Lanka today, and it's not the easiest thing to do at times. So apologies for that. Second question to you, Ajay. Main concern with a lot of people, particularly with elderly or not middle-aged people upwards, are dental implants safe?
They're quite safe. Like the dental implants, almost from the past 40 years, we have been using dental implants. And there's a lot of research work has been done, and a lot of advancement is still going on. And it's definitely a safe tooth.
So the next question to you is, how painful is getting a dental implant, Ajay?
It depends. I mean, discomfort, it depends on person to person. Normally, it's not a painful at all. What we do is we give a local anesthesia. And I know the people are really scared of dentistry because they have a phobia. But it's a very simple procedure. And yeah, I know there are a lot of people like you. And they have a phobia, and believe me, it's just a simple procedure. What we do is give a local anesthesia and make your that part numb, totally numb. And again, it depends. In case person is very, very anxiety conscious, and then we can do it under conscious sedation. We give them some kind of anesthesia which makes you better. And in case some patient who are not ready to, and mostly in some advanced cases, so we do it under general anesthesia, where we make the patient sleep and do it under general anesthesia. And it's not even for the single tooth, it's not a painful at all. It's as good as normal restorations or something like that.
Thanks, Ajay. It's like orthodontic treatment. The most common question what is asked after the course is how long does a dental implant procedure take? So
Yeah,
as an expert, what would you say?
The time period is really, I mean, I believe when we started, or I'll say around in early 90s, so there was a protocol, like any implant, we have to wait for the lower jaw, we have to wait for 6 months, and for the upper jaw, it's almost 1 year. Then it came reduced to almost 3 months for the lower jaw and 6 months for the upper. It depends on your bone, the quality of the bone, the quantity of the bone, how much bone we have, because we have to place a implant inside the bone. And then it depends on the patient's own response to that particular foreign body, because implant is in a foreign body. So how the patient's physical health, how do it respond? But normally, yes, it takes good time. But now we have some procedure where we can give the teeth immediately, because we cannot send the patient without teeth, like in case of the full mouth where patient doesn't have any teeth, or patient there. Most of the time we get a patient in the falling dentition where they're scared of losing their teeth. Or most of the time, like they will having mobile teeth where they are not able to chew, and moreover they are not confident, and they don't speak much, they don't smile, and then they want a teeth. We cannot send the patient out of our office without the teeth. So we have nowadays, like as I said, the dentistry and the implantology as well, there's a lot of advancement, and we have a technology where we place the implants, and with the digital technology we give the teeth immediately. But yes, for the permanent restorations, for the permanent teeth, that's a temporary, that will look good, but you won't be, I mean, the patient won't be able to eat solid food. So for the permanent restorations, we have to wait. I mean, we ask the patient to come back after 3 months minimum. It can be 2 months, 3 months. Again, depends on the number of teeth and the number of the implants and other factors. So normally I'll say it's range from 3 months to 6 months. And that's it. Another thing, in case we are doing some surgery, advanced surgery means in case patient doesn't have a bone, we have to put some artificial bone. So in that cases, we have to wait a little bit more. It could be 9 months or 1 year sometimes. But yes, we can give a temporary teeth immediately after the implant placement.
Would you say, Ajay, it mainly depends on the oral health and the general health in general? That's what will mainly determine how long the procedure will take?
Yes, that's one of the major factor, I suppose, because because once a patient is losing tooth, because it's not because of as I said, okay, we have this is artificial, we are replacing the missing tooth. So why patient is losing her or his own permanent tooth? That's it could be due to some poor oral hygiene. So we make sure, so next time, like whenever we place implant, so in case we are giving some artificial teeth also, we ask the patient to make sure to maintain or his oral hygiene. That's very, very important. And without that, definitely, no, we cannot give a permanent restorations immediately. Then we ask the patient to live without teeth for some time.
Thank you, Ajay. I think it was beautifully explained. So, most of the time, implants are becoming very, very popular these days. There's no questions about it. So what are the benefits of dental implants? Why should someone choose implants rather than something else?
Yeah, lots. I believe nature has provided human beings, so the God has provided the two set of teeth, two dentitions. Like one is the first, we call it the milk teeth. Like they start from as Frank said, okay, the mixed dentition period. So that's like till the age of the 12 years. And then after that, we get a permanent teeth. The milk teeth, it shed because of the nature, right? It has to go. But the permanent teeth, it goes away because of your fault, I mean, our fault or patient's fault, right? in case you don't take care of your oral hygiene properly. That's a main thing. Now, implants provide you the third set of a teeth. That's by human, right? For human, and third set of your teeth, which is like as good as your permanent. I'll definitely say it's better than the permanent teeth, and a lot of benefits. As first benefit is definitely the two main things. Like any patients come to your office, dental office, they want a smile, aesthetics, and the second thing is a function, right? They have to chew, therefore that you need a teeth, or in case of smile, you need a teeth, right? But apart from that, you get a lot of confidence. And okay, some people, they say, okay, you get a confidence with the other, I mean, you can chew with the other set of a teeth also, you call it a denture, but people are not confident. Believe me, it's very difficult when the patient who is wearing a denture and you just ask him or offer him some nuts, he won't take it. Trust me.
Yeah.
And
Yeah.
in case of with the implants, yes, they can chew. I mean, they can have anything. Believe me.
Yeah, sure.
That's a big advantage.
I do trust you, and but on one thing with the caveat that no, even implants, for that matter, is not a miraculous solution. So everything has its pitfalls and advantages. So it's important for a dentist to comprehensively assess the situation, I guess. So yeah, of course, implants. If, for example, if circumstances permit, if I had to ever go for it, it would be an implant. But I think I wouldn't take it for granted. You can always go for implant. But with what you said, with the permanent teeth, it is always our fault. I know you for almost 3 decades. I know that's not what we meant, but it is a combination of nature and nurture. So some people, unfortunately, due to different circumstances, also can lose their teeth. For example, it could be accident, it could be due to gender health, genes, always blame the parents, right? Genes also can play a role. For example, if you have, God forbid, the big C, the cancer is becoming more and more common. And because of that, some of the teeth might have to be taken out. Road accidents, as I said, some people are born without some of the teeth, with some teeth missing. So these also can be on top of. Neglect is the most common bit. I do agree with Ajay. That is the most, because even if you are genetically predisposed, you can always look after it much better.
Definitely agree. It's good you mentioned about some cancer patients. So recently, I think because of COVID, we had a lot of mucormycosis patient. So that's your fungal disease like black fungus, where patient they lose their maxilla as well as teeth. So we did some implants for them. That's some other way of placing implants in your zygomatic bone and give them a teeth. That's really, I mean, it's a pleasing when we give them a teeth, because those are the patients, they are really needy. I mean, it's not their luxury, it's their necessity. So we believe, and some, as you said, cancer patient, some people, they lose their bones or the teeth, and definitely it's really important to replace the teeth with the implants. And genes, definitely, yes, they play an important role when somebody loses their teeth. And
thank you so much, Ajay. One last question to you. The most commonly asked question, the last, is how long do the implants last? Okay, it's great. It is the best thing. You have convinced the patient wants it, you have gone through the course, the patient accepts it. But everyone wants to know, fine, we are spending thousands of pounds or thousands of dollars or thousands of rupees, tens of thousands of rupees, I would think. It is, then how long is it going to last?
That's a very important question. Believe me, every patient, they have a right to ask me also, and to have anybody. And it's a very important, because they're spending a lot of money, and they need to know how much, like whether it's a lifelong or 5 years, 10 years. It's not, I mean, anybody, I don't think so any dentist can justify, okay, can guarantee you it's going to be last. But yes, literature, or I have experience of 18 to 20 years. I've seen the people who have been with the implants like previously also, they are doing very well. Only 3 things which are very, very important. First thing is their oral hygiene. They have to maintain the oral hygiene. Otherwise, it's as bad as your other normal natural teeth in case you don't maintain your oral hygiene. So what do you have to do to maintain oral hygiene? We know about it: brushing, flossing, and maintenance. And visit your dentist. Second very important thing is visit your dentist after every 6 months to show it, like whether you have a pain, you have a problem. No, it's not a whether you, in case you get some loosening teeth or some some swelling part of thing, then only you visit your dentist. You visit your dentist after every 6 months. And then third and most important thing, which normally the people, they just forget about it, is like to about the food habits, about their medical health status and the food habits, like
And the
as I
social
said,
habits, and the social habits, like smoking.
exactly, social habits like smoking, very important. So we have to take care of that. So in case you take care of the three things, I believe implants are there for life. And only thing is like we have to be careful about that. Right?
Thank you so much, Ajay. I know personally people, because the part of London I work in, a lot of people go to the part of India where Ajay is, and they commonly ask, we are going to go there, what can we do? I said, okay, I do know someone if you want, because I rather than come back with good set of implants than not.
Thank you
So
so much for the reference. I do get patients from you. That definitely. Thank
so
you.
I do
Thanks.
normally tell, refer to Ajay and say, okay, you can go and contact Ajay and see. So, and I know, so I've seen his work, and his work is really good. So thank you so much, Ajay. It's really, really important. But, on the caveat, it is important for people to know it is not the miracle solution, nothing like your own teeth. So it's perhaps the best thing is to look after your own teeth. And and I think follow-up is another thing people don't do, isn't it? Because just because you don't have a tooth and it's an implant doesn't mean it's sorted. You can also have problems with the implant, and peri-implantitis, it's called, inflammation around the implant. So that is also really, really important for you to bear in mind. There is no quick fix in life, and teeth are no different.
Exactly.
What is your take on it, Ajay?
Yeah, definitely. That's a very important, like, follow-up, as you said, it's a very, very important thing. And because recently I saw, because you just mentioned, recently I saw a patient who came from abroad. Like I saw him after around 12 years. And that's the first time, like he said, after once I placed implants, he visits any dentist. So he was just brushing. He didn't have any problem, but I just wanted to tell him, like, you have to visit dentist after every 6 months or 1 year at least. So, but we get a lot of patients like that, and unless it's a teeth are broken or some they do some damage to some their teeth or some implants, they don't come back for the follow-up. It's difficult. It's really tough sometimes. What we do is, that's why we don't give any warranty or guarantee. So implants are going to be a lifelong. I'd say like in case you come to us after every 6 months or 1 year, we can take care of that. Otherwise, thank you.
Maintenance. Thank you so much, Ajay. Now, Dr. Lankar Mahesh, it's your turn. Can your mouth reject an implant, Lankar?
Yes, if you have a titanium deficiency, which is very rare, so IL-6 and kind of things, very few. I have placed thousands of implants, but I have had only one patient who had titanium deficiency, where all implants failed, and all. I mean, we did 3 times and all failed. And then we had to get his tests done, and he had titanium deficiency. I have rarely seen a titanium allergy. Your hip joints, your knee joints, all are made of titanium. So somebody is undergoing a bilateral hip or a TKR, like a total knee replacement, it's all titanium.
Sure.
But I had one patient, it's unfortunate, and then we got his test done in England, by the way. He had to go to England to do the test, and he had a titanium allergy. So it's very rare, very rare.
Of course, yeah. I mean, that's the reason. That's the reason it is the choice of material, isn't it?
It can happen, and we should be prepared for it. But like you very rightly asked rather, and Ajay said that you have to, when we do thousands of implants. I mean, my first implant was done in 1998, and the patient still has the implant. And she still comes to me for a visit, every 6 months. the problem is that people don't come back for a visit. That is the problem that I have seen.
Sure.
Because they don't come back. I have done your implant today, I have given you a tooth, and then you disappear. So that I don't know how it's in the West, in the East, or I don't know. Things differ. Things differ everywhere. Things differ. You know, we do large bone grafts, we do cancer surgeries, and you know, like Ajay is an oral surgeon. Ajay does a lot of big, orthodontic surgeries and things like that. And once I started traveling, met people, I published all over the world, lectured in 47 countries. We all are the same. Human beings are the same. Everywhere. Everywhere. But the problem is an implant expensive? No. No, it's not expensive. You have a primary dentition, you have a secondary dentition. Implants are a tertiary dentition. That's the last thing you can have. That's the last thing you can have. We do a single or implant. But how long will it last? Like Ajay said, very rightly, I tell patient, does anybody who gets a bypass surgery, cardiac bypass surgery, ask the cardiologist how long will it last?
Of course they do.
Yeah, it doesn't. And if you look at literature, the maximum success rate in any surgery in the world, ophthalmology, gynecology, or bariatrics or neurosurgery, dental implant stands at the maximum, 99.6. 99.6. No other surgery in the world has this much success.
You have convinced us, Lankana.
It has to come back for a checkup. And like Ajay has a lot of international patients. I have a lot of international patients. The issue we face, biggest issue that I face, is that if a patient is from Norway or Sweden or London or California, then they ask you for the implant size because the dentist is confused. What implant is it? What is this? So, because patients don't. I mean, I don't know.
Thanks, Lanka. I think we already spoke about how soon after the tooth extraction can you have an implant, because I think Ajay kind of addressed the question, unless you want to add something to it.
See, when the implants started with Bernamar 40 years ago, the option was to let the tooth heal, let the socket heal, and then place an implant. Today, we place immediate implants in almost 99% of our cases. 99. You remove the tooth, because one LA is short, local anesthesia, remove the tooth, place the implant. But the bone should be healthy, there should not be an infection, and the bone walls has to be good, and the patient has to agree. The biggest thing is the patient has to agree. We have only refused patients for implants because of finances or bisphosphonates, which is a horrible drug for the jaw. I mean, general public does not know it. Bisphosphonates, oral bisphosphonates. When a patient, they don't know it. They just come with a prescription, and we don't place implants for them. Or they have autoimmune disease. They have Sjogren syndrome. They have something like that. We don't place implants for them. Otherwise, every tooth, like Carl Misch said, every missing tooth needs an implant. He can do an immediate implant in an upper molar, in a lower molar, everywhere. It saves the patient time, money, and it saves a second surgery. So it's not an issue that we are facing, but the patient has to know. You know what happens? Let me be honest with you. Let me be very honest. The implant is done in London, the crown is done in Delhi. For example, or vice versa. I do the implant in Delhi and they go to Pam in California for a crown. It gets very confusing. It gets very confusing, and it confuses all of us. So the patients have to understand that implants nothing is permanent. Nothing is permanent. A bypass surgery, a hip, whatever. Dental implants have 99.6% by Libby, by Mesh, by everybody. You see literature, everywhere is there. It's my personal view.
I agree with that totally. Thanks, Lankar. It is, as I said, no, nothing is a miracle solution. So as far as implants goes, what is the downside of dental implants?
Downside?
Yes, correct.
I don't know. I don't know downside because patients fear. I think patients fear of surgery is the downside. I have never seen downside. Me and Ajay have worked a lot, and Ajay has spoken so well. He does orthodontic surgery. He does stuff like that. There is no downside to implant dentistry. We don't do implants unless the patient. There are two reasons we don't do implants for patients. Just two. Medical, if they are compromised. Second, that's it. That's it. There's no third reason.
I just wanted to ask, what if the patient smokes 20 cigarettes a day? Would you say the patient is still a good candidate for implants?
With smoking implants, it's not that it's not done. We do it. We ask them to control it. And a smoker and a soldier, they never die. So they always say we won't smoke, but they still go on. So we don't know. Like I told you, the first implant Menaka placed in 1998, it's still working.
I agree. You're one of the first people, at least in our batch, to do the implants, I'm sure. And you have been doing it since then. But I had to ask the question because for lay people, it's an important question to know. Who are the good candidates for dental implants? In your opinion, everyone in that case? Because if there's no downside, then everyone can have implants, right?
Everybody can have implants. Anybody who's healthy can have implants. Unless you're on bisphosphonates or you have some autoimmune disease, only then.
Thank you, Lankar. I know the success rate is quite high, but I just wanted to drive the point home that even implants can fail sometimes. That's what I wanted to say.
Of course, I'm glad you asked this. I'm very glad you asked this. Implants can fail. They can fail, and they do fail. If I have placed 30,000 implants, I have lost 1,000 implants. It happens. It's not because of the doctor or the patient. Sometimes the bone condition is bad. Sometimes there are medical issues. Sometimes the patient doesn't come back. Sometimes you use a bad quality implant. That's very important. Also, remember that you have to use a very good quality implant.
Yes.
A very good, because patients don't know. Patients don't know.
Lankar, don't you think so? It's not only bad quality implant, but it's the right implant for the right patient at the right time.
Exactly. I agree.
Sure. Thank you, Lankar. One last question to you. And people who know Lankar knows very well. It's not easy to convince Lankar, so I'm glad I did. Next question to you, Lankar. Next question to you, Lankar. For missing teeth, what is a good teeth-supported bridge or a dental implant?
It again depends on the patient. If you're medically compromised, I will not do an implant. We'll do a bridge. But you cut 656 millimeter of teeth to give one tooth, to give a bridge. It's better to give an implant. But if you're medically compromised, and see, I have in 25, 30 years, whatever, I have seen patients don't want to go for implants only for two reasons: finances or medical reasons. Medical reasons, we don't do implants.
Correct.
Yeah, that's but like Ajay rightly said, an implant is a tertiary tooth. We have primary, then we have secondary, tertiary. In the West, it's very big. We have to educate patients. People tell them. But now, patients come and tell us.
Thank you so much, Lankar. I think it is like everything else, isn't it, in life? Like there are so many complexities to every treatment possible in the world. So it's about going to the right people.
Menaka, you asked Ajay that what happens when implants fail. That's a very important question for people who are listening to the show and who are online right now. What happens when implants fail? When implants fail, we replace them. That's what happens. But when a bypass surgery fails, you don't replace a heart. Bypass surgery has a success rate of 37%, and dental implants have success rate of 99.2%. So, well.
Yes. I'm sure you have convinced all of us.
That's how it is.
I was about to say, between you and Ajay, you have definitely convinced us to take implant more seriously. Thank you so much, both of you. It's been an amazing session, and more than, of course, it's been a high quality session, but more than that, it was so much fun to host 4 people who I studied with. It doesn't happen very often. So thank you so much.
Thank you very much. Let me tell you something. What Pamela said was actually very nice. Very nice. Very nice. She explained it very simply and in a very nice way. And then, of course, Ajay is a maxillofacial guy. He does TMJ, he does ankylosis kind of stuff. And Frank also spoke, and I met all your friends. It's been very nice to be here.
Thank you so much.
But remember, implants work.
we wouldn't dare to differ now.
Implants work in every part of the body. Every part of the body, implants work.
Sure. Thank you so much, Lankar. We will be coming back to the speakers. Thank you so much, people who are on the Zoom. Please hold on. You will be asking questions from the speakers themselves. Following tradition, I am going to announce the next session, which is the episode 81. It's going to be the International Women's Day celebration, because 8th of March is the International Women's Day. It would be with Krishna Pujara, Ivy Josiah, who is a Malaysian women's human rights advocate, Shilpa Ajwani, who is a founder and CEO of Mantra team. And the theme for this International Day is Break the Bias 2022. So can't wait to listen to them coming and talking about that. Now, over to Kirby Kahoot to give the vote of thanks.
Well. It was an interesting discussion today. But before I give my personal thanks on behalf of Meet Menaka celebrating you, we would like to thank all the people who are on Facebook, who have always been supporting our cause, and we want to thank you. And for those who are on our Zoom platform, we also would like to thank you for your support and your support in every week coming on Zoom and participating on this beautiful Zoom connection, celebrating each one of you. But last but not least, connecting from India, Middle East, US, we want to thank Technologies of Zoom from all over the world. We have now had this esteemed guest speakers, a melting pot of brains, I would say. A congregation of Bangalore dental class reunion presenting. Wow, that's really amazing. And personally, I would like to thank Dr. Ajay, Dr. Frank, Dr. Lankar, and last but not least, Dr. Pamela, for your insightful sharing and insightful, beautifully, simply explain to people like me who completely are frightened about dentists and dentistry. But you know what? You made me very comfortable. But for for a little pun. It says, be true to your teeth, or they might be false to you someday. With that, I will tee off now. Menaka, take over.
Thank you so much, Kirbe. I love the last bit. I am going to steal that from you. So thank you so much once again, Ajay, Frank, Lankar, and Pam. It's been a great session. And we are going to come back to questions from the guests after this. For people who are listening to us on Facebook, it has come to that time of the day to say goodbye from Sri Lanka. In few hours later, unfortunately, I'll be saying goodbye to Sri Lanka itself. So thank you so much for putting up with me. Wi-Fi was playing up. And thank you so much for supporting us. Please do subscribe to our channel, Meet Menaka on YouTube, to make impact and make the change what we really want to do across the globe. So thank you so much. Until I see you next week about International Women's Day celebration, keep healthy, be happy, and keep smiling.